Hi, thank you for watching Digging to China. I'm Dong Shong. This episode is about China's race for a coronavirus vaccine. Chinese vaccine makers have developed 4 vaccine candidates that are in the final stages of testing worldwide. No vaccine has yet completed crucial phase 3 trials. Phase 3 trials are needed to firmly establish safety and efficacy. But that has not stopped Beijing to inject one of the 4 candidates to hundreds of thousands of people in China and abroad. China did it under policies known as emergency use authorization. China's military began getting vaccinations in June, and it quickly expanded to medical workers and employees of state-owned companies working abroad. In September, a China national biotech executive said 350,000 people outside the clinical trials had already received the vaccine. In March, a military general named Chen Wei was widely praised by social media users. She is an epidemiologist leading one of the coronavirus vaccine efforts, and she received an injection before it had been tested on animals. In September, Ying Weidong, CEO of Sinovac, told reporters that he was one of the first to take the vaccine after past the first 2 trial phases. About 90% of Sinovac's employees have taken the vaccine early, the company said. In October, China National Biotech Group reportedly began offering free vaccine to Chinese students planning to go abroad. The company website said more than 93,000 people had signed up for the free vaccine. But state media later reported that the free vaccine offer was not real, and the company website was later taken down. Now, scientists are concerned about this. They say Chinese government needs to wait for robust trial data that show the vaccines are safe and effective before granting vaccines full approval. Chinese health authorities have said that the vaccines are safe with no severe adverse effects and that their emergency use is justified. But health experts outside China are questioning the safety and ethics of such a strategy. Such a risk might make sense in a country where the virus is spreading and the frontline workers are constantly exposed to COVID-19. This is not the case in China because China has largely contained the spread of the virus, or did it? Why does China take a huge gamble by giving vaccines to people who are healthy? It is unethical and it is dangerous. LA Times published a feature story regarding China's large-scale vaccine applications. An anonymous oil worker sent copies to the Times of the consent forms and the confidentiality agreement he had to sign before receiving the vaccine. He also provided screenshots of WeChat discussion about vaccinations among his colleagues. The anonymous worker is usually based in a Persian Gulf country but has been stuck in Beijing since January. The worker said he received the vaccine in September as a requirement for all staff working abroad. There was no written document forcing them to receive the vaccine, but workers were not being cleared to return to their jobs abroad unless they were vaccinated. It was politically incorrect to question the vaccine at the company he works. Most of his colleagues were eager to get it. They were more afraid of catching COVID-19 abroad than of safety concerns with the vaccine. Some managers were rushing the vaccinations by encouraging employees to receive 2 shots at once instead of waiting 14 or 28 days between injections as recommended. A consent form shared by the worker appears to verify this account. It says, if you urgently need to go abroad and truly cannot complete the 2 shots vaccination, you can consider receiving 2 injections at once, 1 each on the left and the right. Vaccine doses are usually spaced out so that the first priming dose sensitizes a body's immune system to recognize a new pathogen. The second booster dose stimulates higher antibody levels. Giving 2 doses on the same day is an attempt to drive antibody levels high by giving more vaccine. It is more like applying brute force. Premature vaccine use can create a false sense of safety, and that could help spread the virus. More testing is needed to show how effective the antibodies are, how long they last, and whether they can protect against different strains of the coronavirus. These are the questions that cannot be answered in China. The lack of an active outbreak makes it hard to prove whether a vaccine is working. There are other risks too. Antibodies from new vaccine in rare cases can be found to make things worse. So why? Why take such a risk when there is no immediate scientific emergency? Yang Zhonghuang, a fellow at the Council on Foreign Relations, says it's more driven by commercial interests than by the public health needs. Companies like Sinopharm, who has developed the vaccine candidate and is conducting large-scale testing, will not have any pricing power once the vaccine is approved and formally rolled out. The government will control that. Right now, they can charge what they like. And they somehow successfully persuaded the government to leave open this window. Another theory is that this is part of China's soft power projection. The world knows COVID-19 originated in China, and the Chinese Communist Party did a shameful job by initial covering up. Developing a vaccine might alleviate some of the anger. Brazil's health regulator approved the import of 6 million vaccines from Sinovac in October. The UAE approved its own emergency use of Sinopharm vaccine in September. Sinovac has agreed to supply 40 million doses of its vaccine to Indonesia by March. China announced last month that it was joining COVAX, a global initiative to ensure equitable distribution of vaccines to developing countries. Now, right before I filmed this episode, I received this new development of China's vaccine. China's Global Times and the China Central Television CCTV posted tweets on Monday citing one of the country's top COVID-19 experts, Zhong Nanshan, who said the Chinese vaccine in question was about 90% effective at preventing infection with the novel coronavirus. But listen to this, efficacy rate will not be publicly released until the results of the first phase of trials are available, the tweet said. All right, fair enough. I'll see about that. But again, safety first. Beyond health, rolling out vaccines prematurely raises other risks for China. Over the years, a string of quality scandals has people inside China and out skittish about made-in-China drug. If something goes wrong with these vaccines, it would be a disaster. That is my take. Thank you for watching. Please leave a comment and subscribe to my channel. Just click the subscribe button right here. I will see you again shortly.